Welcome to our final lecture episode or mini lecture for this week. This is week one, mini lecture number 7, concluding our lecture series on the review of healing and rehabilitation. So we will move right on to look at how we can time rehabilitation and programming. Such that it aligns with the healing process. And essentially, the key point here is that designing a rehab program and progressing a patient should be based on where the injury is in its healing process. So what you can see here are the number of phases as we move through the healing process. There are 4 major stages: hemostasis, inflammation, proliferation, and remodeling, as we have spoke about in the preceding lecture episodes. We will go through tables that identify various aspects of rehabilitation and coordinate or align it well with the healing phases that I've just mentioned. And a rehabilitation progression will always really be determined by where the injury is within its healing process. And so being able to identify the healing process and appreciate where a patient may be within this journey to rehab is essentially vital to being able to create a successful program. Clinicians also must be aware of modifying factors that may alter the normal healing time. So, for example, we've talked about the impact of age with older adults, and those who may have chronic diseases may take longer in the healing process. So, from this perspective, it's important to obtain an accurate and thorough history at the time of examination. Now, um, we've talked about modalities and using various modalities throughout the healing process. Some may be more appropriate than others at a given time, but you can see the various modalities and their effect on healing, modulating pain, blood flow, metabolism, um, and the promotion ultimately of healing and facilitating muscle activity and function. And so this is a nice summary table. Now, once again, if we are trying to align the timing of rehabilitation with the healing process, I want to just reiterate some of the key tenets or ideas around hemostasis. And so we know that hemostasis obviously is that arrest in bleeding with clot formation. You have the fibrin plug formation that occurs following and immediately following an injury. And as such, it's a very quick and short phase of healing. And the damaged blood vessels that result in an outpouring of blood ultimately must be stopped. A combination of cold therapy or cryotherapy, as you might see it in your textbook, as well as elevating and the use of compression is very commonly used as a form of treatment. Once again, to stop bleeding and encourage plug formation. And this phase really focuses on minimizing injury effects by reducing bleeding and the loss of fluids from injured tissues. As such, cold therapy really is the only modality of choice at this stage. Also, immobilization or limiting the use of the injured segment will provide for reductions in pain and minimizing additional injury. Uh, Similarly, or I should note, cold therapy is preferred. Heat modalities are not used during this phase since thermotherapies will increase cellular metabolism, vasodilation, capillary permeability, and obviously that is undesirable at this early phase. Exercise or movement of the injured segment is also contraindicated since it may disrupt blood clot formation, and an individual may be at a very high risk to exacerbate or worsen the injury. Next, if we consider the inflammation stage, once again, it's your macrophages, which are really trying to clear and remove debris so that fibroblasts can start to rebuild and remodel tissue. And during this time, heat modalities and therapeutic exercise are also not preferable. Now let's move on to early proliferation. So we've talked about changes in collagen in terms of its formation, in terms of its configuration or arrangement or alignment, and how that at the end state goal, um, that collagen formation in an appropriate configuration or alignment can ultimately provide a very strong and resilient tissue. Early in the proliferation phase, you have type 1 collagen that's forming, allowing the area to become stronger and withstand stress. And any remaining signs and symptoms continuing on from the inflammation stage into this phase can continue to receive treatment with the same types of therapies used during the inflammation stage. As we move later on into the proliferation stage, heat type therapies can be frequently used in place of cold therapies, as can electrical stimulation, uh, joint mobilizations used to reduce pain and improve mobility of soft tissues can occur, as well as stretches can be initiated to promote range of motion and improve mobility within the joint. And I apologize, I forgot to advance my slide here, but you can see all of these major points listed here. Um, and so that concludes the third phase of healing and how we align our rehab program. Now, if we move on to early remodeling phases, um, obviously it is during this phase which tissues become more permanent structures. We've talked about the conversion of your collagen fibers and how they align properly to promote strength, resiliency, and healing. Exercise can be considered at this point. However, the intensity of the exercise should correlate with the tissue's ability to withstand stress levels in accordance with the healing timeline. Now, as we're moving into the later stages of remodeling, so the final stage of healing, modalities such as if we think about our heat or cold therapies or electrical stimulation may not necessarily be prioritized. Rather, we should start to really focus on functional and activity specific exercise to, allow for the injured segment to adapt to normal stress. And exercises should obviously be chosen that are specific to the functional demand needed. So we think about trainability and being very specific in choosing exercise that are going to essentially allow us to train our bodies to be able to do the activities that are desirable or necessary or mimic what we are able to do prior to the injury. Here is kind of a disclaimer, understanding that rehabilitation times vary. It's sometimes hard to estimate how long it can take for the rehabilitation process. There are a number of factors which I've listed here, thinking about patient compliance, which body parts are affected, the severity of the injury, and so this often is very commonly asked but very difficult to answer. Patients will often, ask how long before I can start running, or, when can I go back to work? And so it is very difficult to answer. There are also additional factors beyond what I've mentioned here. If we think about the type of tissue that was involved, we spoke about that in the preceding lectures, the age of the patient, for example, the obviously the physician or surgeon's perspective if they've had some sort of surgical repair, particularly if they've had prior injuries to the body part that is involved. If they are a competitive athlete, for example, performing very high intensity exercise, all of these factors may be quite uh, um, necessary for consideration. As one example, if we think about muscle and the rehabilitation of muscle, actual changes in muscle size are not seen for 6 weeks after strengthening therapeutic exercises are initiated. Um, this is, just one example, but these, slow response times to exercise can lead to individuals feeling somewhat uh, discouraged or depressed about their condition. However, it's normal, and perseverance is really needed, such that the patient can see gains. So here are just some summary notes, but obviously really tying the healing process in with a rehabilitation program and progression is required for ultimate success, and also one's treatment choices and their success will depend on being able to accurately identify where a patient is within the healing process. And so I will leave this week's lecture series with these two summary charts, which nicely align or coordinate rehabilitation program activities with timelines. So once again, um, ultimately important to consider those various healing phases with the typical timelines and characteristics that you would see, rehabilitation interventions that may be most appropriate, and the goals for rehabilitation. So this is a really nice concluding slide. This you should be quite familiar with. We have talked about this now on various slides throughout this week's presentation. And this ultimately is imperative to ensure a successful rehabilitation program.